Hello, my name is Dr. Zachery Smith, and your dog has been diagnosed with a medial patella luxation. So medial patella luxation means that your dog's kneecap, which is the patella, does not stay within the groove at the end of the thigh bone. So naturally and normally in a dog or in a human, that kneecap should always remain within the groove at the end of the thigh bone. So if you reach down and just take a grab of your kneecap, what you'll feel is that the kneecap can move a little bit back and forth, but it can't displace significantly to the inside medial or outside lateral. It stays within the groove there at the end of the thigh bone. Dogs that have medial patella luxation, they are born with a malalignment to their quadriceps mechanism. So this is the mechanism in which the patella lives. The quadriceps mechanism is made up by the quadriceps muscles, which are the muscles on the front of your thigh, the patella, which is that kneecap, and then the patellar tendon, which is the extension from the kneecap down to the shin bone. And that's where the doctor will hit you with the little hammer to make you kick to test your reflexes. So that mechanism should be aligned right along the front of the thigh bone, and it should transect the center of the groove at the end of the thigh bone or the femur. If it doesn't, if that patellar complex or that quadriceps complex is displaced either medially or laterally to the end of the thigh bone, then we will develop a patella luxation. The most common way that this is demonstrated or seen in dogs is most of the dogs with a low-grade patella luxation will be running normally and then suddenly pick up their leg. And they'll usually hold it up for a step or two before putting it back down in its normal position and resuming a normal gait. As it becomes more advanced, what we'll see is that intermittent lameness may become more persistent, more common. And as arthritis develops, we'll see it where it actually becomes a persistent lameness. Now, if a dog's patella actually is completely out, where it cannot go back into its normal position, so it's completely luxated, which we call a grade 4, then we lose a significant amount of muscle strength from that quadriceps mechanism. So what we'll see is a very persistent gait abnormality and lameness. Additionally, as we get higher in grade with our patella luxations, we'll see arthritis development, and we can develop a cranial cruciate ligament tear or an ACL tear, which in itself can cause a persistent lameness.